So here I'm going to show you a technique for the quadratus lumborum. When I was first taught this technique, it was a sacroiliac joint based technique, and they called it the Chicago. My dyslexia, I now call it the Texan twist. So all we're going to do, we're going to have Kiki's, so we're going to stress Kiki's left side. So we take the leg across the midline. The reason we take the leg across the midline is to stop them rolling into us, but also to pre-tension, pre-stretch the quadratus. Remember, the quadratus is a hip hiker. So by us doing this with the legs, we're already depressing the hip. We want to create space between the lower ribs and the ilium. So this banana shape does that. Kiki will place her left arm behind the head. Again, that adds another pre-tension. This is lifting her rib cage. So most clients are already going to feel a stretch there, in fact. I use a towel. That's just a bolster across her ASIS. So what we do here, we lift and I come across with my elbow, hand, and I contact the lower ribs. So she's going to be feeling a stretch in and around where my fingers are here. I ask you to take a deep breath in. As she breathes out, I push here. Now I move into flexion, rotation, and a bit of side bending. She's got a big cavitation in the lower back. We hold for 3, 2, 1. We release, shake, jostle, breathe in, breathe out, flex, rotate, side bend. So this hand, in the official or in the old sacroiliac technique, would be more of a thrust. As massage therapists, we don't do that, we just hold. Here, QL. So remember from the anatomy we spoke about in earlier videos, the QL is 3 distinct lines of tissue. So when there's 3 distinct lines of tissue, you generally need to hit the muscle at different angles. So we can take Kiki's leg even further across, so we can hook off the table and now hook. So that's a greater degree of abduction. And now what we're going to do, we're going to bring it into more flexion. So now it's more flexion. See, I'm more flexing, then I rotate. Feels okay? So I flex her, so I'm going to get a stretch of the iliocostal bands of QL, more so. Rotate and push. 1, 2, 3. When you're working a pretty deep stretch, it's pretty important to have a good amount of cushion here, because we do have to apply a decent amount of force to stop them rolling into us. So it's 1, 2, grab, take a deep breath in, you feel the ribs expand, flex, rotate, and push. 1, 2, 3. We can also do this stretch with no leg motion. Just keep the legs neutral, and it's going to be a different type of QL stretch. Because the QL is a hip hiker, but it's also a lateral flex of the spine, depending on if it's an open chain or closed chain motion. So you always want to be tweaking the angles of stretch. So let me just show you this. I'm going to lift the shoulder, grab, just slide under, push. I bend my knees, keep lower back safe, my lower back safe that is. We stretch here. 1, 2, 3. Just pull the t-shirt up. So when I'm here, this hand, I'm always kind of grabbing the tissue and trying to create some fascial lengthening also. So my left hand, I'm always pulling this way. Pulling. 2, 3. So that's a great way to open up the QL. I know there's a lot of people always ask at our classes if they're working on big people or they're a small therapist. So in that case, if I'm working on, if Kiki was working on me, a big discrepancy in size, I would have them be really active. So for example, hands in that position again, and we hook the legs. And I would ask them to turn towards me. So have them do the work, so turn towards me, keep turning, and then they're really actively participating here. And turn again, this way. Chain up and change my knees, turn again towards me. Here. So here I'm using my knee, just to brace the ribs, and that creates more of a side bending. Did you feel that more or less? More?
Yeah.
Kiki feels that more. So turn towards me again. So my left knee, the knee closest to the head, I grab, and it's counter. I pull and I push. 1, 2, 3. I know some people aren't comfortable bending over here, and that's okay. Twist. Breathe in, breathe out. When we're doing this, we've got to be careful we're not really crushing down on the scapula, so you sometimes have to change your angles. Turn again, pull this way. We can come and do a two-handed technique here. But what happens here, you'll see, is when we're doing a two-handed technique on the thorax, we do lose a little bit of stability down in the hip, but you'll still feel a stretch. You still feel that?
Yeah.
So this is a bit more nice, more rocking. But you can always come back in this position. Same when you're here. You come here, stretch. Key thing is to try 2 or 3 of the variations and see what one suits your body type, and obviously depending on your client. We always use Kiki as a model for video purposes. So I'm showing you how I would work on someone of this size.